Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life Surgical Arts. Today we're going to talk about a thigh lift or a thighplasty. So, what is a thighplasty? This is a procedure that addresses extra fat, extra skin in the thigh area. So, what are the things that we can do for the thighs? Now, obviously, if it is just extra fat, then we can consider doing liposuction like any other part of the body. Now, if you do have a little bit of loose skin, you can consider doing the Renuvion J plasma, which does help with skin contraction and help to tighten the skin up to about 50 to 60% on the right individual. However, there is a limit to how much the Renuvion can tighten. But if you do have more than just a little bit of extra skin, then you do have to consider something more invasive like a thighplasty. What are the types of thighplasties? So you have your medial thigh lift, which the incision starts in the groin area, and depending on the amount of skin, can have a vertical component down the inner thigh to look like a T when it's closed. And that vertical incision down the inner thigh can go all the way down to the knee depending on how much extra skin needs to be removed. Now, another type of thigh lift is the outer thigh lift or the lateral thigh lift, which means it's the sides. Now, usually this is done in conjunction with a posterior lift, and I've talked about this in another video where we are addressing the lower back area, including the butt and the side thighs. Now, this surgery is a little bit more extensive because you are pulling up the entire back as a unit, and the recovery time can be longer in correlation. So the incision for a lower body lift in conjunction with a outer thigh lift, the scar will sit in your underwear line, meaning it goes across the waist area and goes all the way around. Now, usually individuals who require a lower body lift or a thigh lift often have to address the fun as well in an abdominoplasty or a tummy tuck. So that incision will connect like a belt. So before you decide to go ahead with that thighplasty, you really do have to think about the recovery period. Now, you may go back to work if you have a relaxed job, you're sitting mostly at a desk after about a week. But if you have a job that is much more active, that requires you to be on your feet, and your job is really not going to allow you to have time or be able to work with reduced physical activity, then the thighplasty might not be the best option for you. So how long does it take to recover from a thighplasty? Now, obviously, you will have some downtime. Usually with a thighplasty, we do leave drains, and the drains can come out from the bottom of the knee for the medial thigh lift, and for the posterior lift with the outer thighs, the drains can be in the back. But it is very common to leave the drains in for a few days to a week. You do have to wear a compression garment, and this is surgeon dependent. For my patients, I do recommend wearing a compression garment for 2 months. So during the recovery process, you really do need to take it easy, and you can only resume your full physical activity after 4 to 6 weeks. Another thing to consider during the recovery process is that you do have to limit the amount of stairs that you walk. If your medial thighplasty has the incision in the groin, walking upstairs is going to stretch or put strain on the incision. So this may be a little tough for some people, but you do have to limit the amount of stairs that you take for up to 2 weeks. So what are the complications of a thighplasty? So very commonly with cosmetic procedures, you have the risk of infection, bleeding, poor scarring, limited physical activity, numbness, and also seromas. Now with thighplasties, because it is in an area that tends to move a lot, the scars may not be as nice as, let's say, your breast surgeries. And I also say this for the brachioplasty patients. Because the legs and the arms are an area that always tends to move a lot, the scars have a higher chance of not being as small and thin as the breast patients. So the most common complication that I hear from patients who've had a thighplasty or brachioplasty is that they all say, I wish the surgeon took out more skin. There is a reason for that, because during the surgery, with the swelling and the inflammation, and it could be the anesthesia fluid that's injected at the time of surgery, everything puffs up. Okay? So it's very important for patients to know that you're not going to be completely tight, because it would have put too much strain on the closure of the skin, and it would lead to a lot more problems. However, if there is still a significant amount of loose skin left over the initial thighplasty, you can consider going back and taking out a little bit more skin, but you may have to wait up to 9 months after the original surgery to do any revisions. After this surgery, if you do end up losing more weight, then obviously you may have more loose skin, and that's when you can consider doing a secondary revision. I hope you guys have a better understanding of thighplasties. If you like these videos, please subscribe and follow. Thanks!